Welcome all. In this episode, we're going to expose Senator Ron Johnson for his anti-vaccine activism. We're going to start by hearing what Senator Johnson said at Robert F. Kennedy Jr.'s hearing before the Senate on September the 4th, 2025. I would like you to listen for the name William Thompson.
Thank you, Mr. Secretary.
Thank you, Senator Johnson.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thanks you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing and permanent subcommittee investigation on that hiding of the signal myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data, and I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021, when I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because of all the censorship in the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination or within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the, again, I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high quality study. I'm not going to steal the thunder of Aaron Seary, who's going to be testifying on this. I think you're aware of the study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta and Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that Black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
The letter I received from the Oshkosh business, it would be out of business because of the 50 employee mandate. It's going to be out of business. I just want to enter that in record as well.
Without objection. The committee will take a 5-minute quick break here just to allow just a moment of reset here, and then we'll start right back up again in about 5 minutes.
When Robert Francis Kennedy Jr. mentioned the study about black kids being 260% more likely to gain a diagnosis of autism, that sounded very odd to me and nonsensical. So I searched out the study. The study actually took place in 2004, not 2002 as Kennedy said. The study he was talking about is all linked to Brian S. Hooker, William Thompson, and the fraud Andrew Wakefield, who exacerbated the anti-vaccine movement with a paper in 1998 published in The Lancet. Here the results of the study RFK was referring to. It says, I quote, "When comparing cases and controls receiving their first MMR vaccine before and after 36 months of age, there was a statistically significant increase in autism cases, specifically among African American males, who received the first MMR prior to 36 months of age. Relative risks for males in general and African American males were 1.69 and 3.36 respectively. Additionally, African American males showed an odds ratio of 1.73 for autism cases in children receiving their first MMR vaccine prior to 24 months of age versus 24 months of age and thereafter." End of quote. And the conclusion came to say, I quote, "The present study provides new epidemiologic evidence showing that African American males receiving the MMR vaccine prior to 24 months of age or 36 months of age are more likely to receive an autism diagnosis." End of quote. That's the alleged link RFK and Ron Johnson said the CDC deleted. Hooker manipulated the data to suit his purpose. There were not enough African American boys of a specific age range in the original study to draw any definitive conclusions, so he extended the age range. This is what epidemiologists call the Texas sharpshooter effect, an approach in which someone draws a target around the shots already taken to prove he is a good shot. Hooker selected data, points that supported his theory, rather than allow the data to drive him to a conclusion. Concerns were raised about Hooker's analysis. Hooker believed his autistic son's autism was caused by vaccines, and this brought on alternative interests. It says, "The publisher of this article has serious concerns about the validity of its conclusions because of possible undeclared competing interests of the author and peer reviewers. The matter is undergoing investigation. In the meantime, readers are advised to treat unreported conclusions of this study with caution. Further action will be taken, if appropriate, once our investigation is complete." End of quote. I decided to look into their investigation. After further investigation, they retracted the paper saying, I quote, The editor and publisher regretfully retract the article as there were undeclared competing interests on the part of the author which compromised the peer review process. Furthermore, post-publication peer review raised concerns about the validity of the methods and statistical analysis. Therefore, the editors no longer have confidence in the soundness of the findings. We apologize to all affected parties for the inconvenience caused. End of quote. In August 2014, anti-vaccine activist Brian Hooker and Andrew Wakefield released a video of recorded phone conversations with an individual named as Dr. William Thompson, who is identified as a researcher at the US Centers for Disease Control and Prevention, CDC. The person on the recording claims to have evidence that the CDC altered the rules of data collection for a study in order to omit data which would have shown African American boys had a greatly higher incidence of autism after MMR, measles, mumps, rubella vaccination. Hooker used the raw data provided to him to write and publish his own analysis. Dr. Thompson, however, has not spoken about the issue in public, releasing only a statement through his lawyer that does not address the claims he made to Hooker and Wakefield. Independent reviews of his claims have shown there is no evidence of an increase in autism cases after vaccination in African American boys or any other subset of the population. Another person comes into this who found out more, a journalist called Brian Deere, who followed the tracks of Andrew Wakefield. Brian Deere writes in his book, I quote, Hooker moved on, briefly argumentative. He spoke of spreadsheets and stuff like that, before closing in on the topic of thimerosal. I mean, I've got all the records, he said. I see that on the New England Journal of Medicine paper, you were pressured to downplay the relationship between thimerosal and ticks. Pressure to downplay, again, intent, but again, the fish didn't bite. Well, let me just say this, Thompson replied, referring to a minor paper he'd published with a student. I did a follow-up study, because I wanted my opinion on the record. How Wakefield's heart must have sunk with these responses. Then his associate tried a third time. So, did you feel in the 2007 paper that you were pressured to downplay significant results? No, replied Thompson. Damn. In fact, during that same follow-up call on June the 12th, 2014, they even stumbled towards a possible reason why the autism rates among some vaccinated black kids had appeared to be significantly different. African American children tended to get worse health care, and when they eventually turned up with developmental issues, they were offered the shots they'd missed. It likely wasn't vaccination causing their autism, but their autism causing vaccination. In short, the study was badly designed, using data collected for quite different reasons. Its results could never have been solid. So, in fact, you could argue the pediatrics paper is like a bunch of crap because the better educated mums get their kids vaccinated earlier, Thompson said, laughing. We had a crap study because we weren't even adjusting for the appropriate variable. Right, Hooker replied. End of quote. So throughout the whole thing, it was badly designed, the whole thing that RFK is referring to. You then got Ron Johnson supporting him on all this crap study. If a journalist was able to find this out, Brian Deere, what on earth do the senators in the US not know about this? And if I were able to find it out from my research, why on earth don't they fact check RFK? The Senate, the Congress, the federal government. Anyway, back to Senator Ron Johnson. For years, Senator Ron Johnson has been spreading conspiracy theories and misinformation about COVID-19 and the safety of vaccines, just as we saw him doing in the video at the hearing in the Senate. He's promoted disproven treatments for COVID-19 and claimed, without evidence, that athletes are dropping dead on the field after getting the COVID-19 vaccination. Now, the Wisconsin politician is endorsing a book by a discredited doctor promoting an unproven and dangerous treatment for autism and a host of ailments. Chlorine dioxide, a chemical used for disinfecting and bleaching. The book is The War on Chlorine Dioxide, the Medicine That Could End Medicine, by Dr. Pierre Corey, a critical care specialist who practiced in Wisconsin hospitals before losing his medical certification for statements advocating using an anti-parasite medication to treat COVID-19. The action, he said, makes him unemployable, even though he still has a license. End of quote. Some of you may be aware who former Dr. Pierre Corey is. Now, what's Senator Ron Johnson doing supporting Pierre Corey? The Global Center for Health Security wrote, I quote, Washington Post, the American Board of Internal Medicine revoked the certifications of Pierre Corey and Paul Marik, two physicians known for continuing to promote ivermectin, an anti-parasitic medication, as a treatment for COVID long after the medical community found it to be ineffective. The two men co-founded the Frontline COVID-19 Critical Care Alliance, which experts say spread misinformation about the coronavirus pandemic. The board's website listed both men's certifications as revoked within the past week, that effectively prevents them from practicing at large hospitals and academic institutions. Published on the August 14, 2024, doctors accused of spreading misinformation lose certifications. End quote. In the United States, you have a Senator, Ron Johnson, who works with frauds who are responsible for the loss of thousands of lives while promoting their conspiracy theories. No wonder the US Congress has been so accepting of anti-vaccine policies. However many children die from vaccine-preventable diseases in the US, the US federal government, the US Senate, the US Congress, the US Supreme Courts are to be held accountable for the loss of those lives, as they are responsible for putting an anti-vaccine conspiracist as Secretary of HHS while upholding his conspiracies. America's leadership should either impeach the whole Trump administration, otherwise they have blood on their hands.